On today's episode of Care Anywhere, I sat down with Louis Brownstone. Louis is the president of WorldWide HealthStaff Solutions, one of the largest providers of direct hire global staffing support. But we spent our time today talking about the work that WorldWide is doing to support the education and training of health workers in African countries like Kenya through their partnership with Books for Africa. Louis spent a lot of time in early internships and across his career in international settings and is passionate about the way global work opens up our often narrow perspectives of other cultures and changes our point of view on global community. It was a pleasure to hear his passion for that objective and the work that WorldWide is doing in Africa. You won't want to miss this episode, so stick around. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by True Merit. Hi, everybody. Welcome back to the Care Anywhere podcast. I'm Lea Sims, your host, Chief Marketing and Communications Officer for True Merit, formerly CGF&S International. I am joined today by Louis Brownstone of WorldWide HealthStaff Solutions. We're so excited to have you on the podcast today, Louis, to talk about giving back to supporting nursing education and the global nursing workforce, something we're super passionate about at our company and on this podcast. So welcome to the podcast.
Thanks so much for having me, Leah. I really appreciate it.
Love to have you here. We always open with a standard question because we love to hear about everyone's journeys to where they are today. And also because we have a health worker, nursing audience, or those connected to, clinical practice who are either new to their careers or considering career mobility options. What we're seeing happen here is that no two pathways are the same. Not everyone has the same reason for getting into healthcare or taking the same journey to where they are. So I'd love to open with, first of all, tell us a little bit about yourself, introduce yourself, and then we'll talk about how did you get into healthcare specifically and supporting the things that you do today.
Yeah, sounds good. So I'm originally from San Francisco, and went to actually a finance professional. So I studied finance at undergrad, and then I was so lucky to have a supporting family that appreciated international perspectives. And when I was a senior in high school, I did not go the traditional path and follow standard job interviews. But instead, I decided I wanted to spend a year working around the world and gaining international experiences.
That's great.
So one of my friends invited me to stay with his family in India. So I got an internship in India. I traveled around Asia, and then I got another internship in Istanbul, Turkey. And I always encourage young people in their journeys to explore the world. And unfortunately, not so many people follow that path, but I think it would be fantastic for our country if more Americans had the opportunity to experience the world and other cultures.
And see how different things are outside of our narrow point of view.
Yeah, exactly. How things are different, how opportunity to grow, opportunity to learn. I think every place around the world, every culture has something we can all learn from and grow personally from by experiencing.
Yeah.
So from there, I was in management consulting, and I was involved in a couple different businesses in a leadership role, and then joined WorldWide HealthStaff about 3 years ago.
That's great. Talk about them a little bit. What does WorldWide HealthStaff do, and what do you do for them?
Yeah, sounds good. So my role, I'm the president of the company, and we connect healthcare clinicians around the world with job opportunities in a direct hire permanent placement role, predominantly in the United States, some opportunities in GCC Middle East. And we're certainly one of the largest direct placement companies in the United States. We work with almost every state, with hospitals in almost every state, a variety of end user markets from acute care hospitals, acute rehab, skilled nursing, a variety of different options.
Yeah, you guys are part of our Alliance for Ethical Recruitment, which we are
Yep. Yep.
appreciative of the
Absolutely.
support for ethical recruitment practices.
Right.
We have a great relationship there. But let's talk about, I know what we really want to focus on, and I'm increasingly impressed by with staffing and recruiting organizations who are recognizing the impacts that that global movement of workforce is having on both sending and receiving countries, and the commitment that organizations are making to giving back and building infrastructure in the countries that they're working with. So let's focus on you have a lot of your attention on that philanthropic work that you guys are doing, that you're involved in at Worldwide. Why is investing in global workforce resourcing, training, and development an important part of your mission and vision as a company?
Sure. So, it's what we do. It's the core to the service that we offer, and one of our ultimate values, we're connecting really talented people from around the world with
Yeah,
great job opportunities in the United States. So any role that if we can play in supporting the development of those individuals around the world, directly aligns with our mission and what we're trying to do.
yeah,
And in addition to kind of the business side, I think we're a mission driven organization, and we believe in what we're doing and the impact we're having on our clinicians. And I think one of the advantages I've had from living around the world and seeing a lot of different places is recognizing the value, both to the hospitals that these nurses are providing, but also the families and communities that the nurses and healthcare professionals are coming from.
right.
And the amount of, for example, money sent back to
Yeah,
family members back in their home
remittances. Yeah,
countries, remittance,
yeah,
exactly.
yeah,
It's not just there's a lot of people in this chain that are impacted. Americans are getting great care from really talented individuals, and we have a significant nursing shortage in this country.
yeah.
The healthcare professionals are coming to the United States, often bringing their spouses and their children, and brothers and sisters and parents and grandparents and neighbors are often benefiting from remittance going back to their home country. So worldwide, we really believe in this whole chain, and we're lucky to be a part of it.
Yeah, because it's not just the health worker; it's their community, their family, both at home and the new community they're building when they move
Yeah,
here. Yeah,
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 yeah, exactly. The Philippines, for example, almost 10% of their GDP is remittance. So that's
yeah,
money going back to their home country from around the world. It's something like $40 billion,
yeah. It's a lot.
and $40 billion every year going back to a country has a huge impact on their economy. And
Absolutely.
with economic growth, there's prosperity.
Yeah, you're the second guest I've interviewed this week that really drove that point home, around when we hear there's obviously a lot of discussions around talent flight and the movement of talent out of one country and into another, and the impact on the countries, the sending countries. But what people don't necessarily talk about is the reinvestment into those economies that comes through exporting, in a way, those services and those remittances that come back, to families and into communities and local economies. It's a very nuanced
It is, yeah.
picture, honestly. Yeah,
Yeah, and part of this project, I've been spending some time in different countries in Africa, and the welcome that Worldwide has gotten from governments, is something that I've been particularly pleased with.
that's great.
Especially Ghana, Kenya, really open arms, very senior political figures welcoming us to support recruitment of nurses from those countries.
That's great. They have a pool of very talented, highly educated clinical professionals, who need opportunity more than
Yeah,
anything else. Yeah,
yeah, and it's a little bit of a double-edged sword because there's great people and the economic benefit of remittance, and
yeah,
then they're also dealt with the challenges of difficult medical situations and not
yeah,
having the full resources to fulfill the needs of their communities.
yeah,
And I
yeah,
think it really comes back down to economic need, and many
Or
of these countries don't have the basically the budgets to have
right. Yeah.
full-fledged healthcare
That's what we're
systems and
seeing too.
education systems.
Yeah.
So
In
that
those
and it,
sub-Saharan countries, particularly,
yeah,
the issue is not that all of their best workers are leaving; it's that they don't have the jobs to provide for them, and so they're
yeah,
probably more supportive in those cases of the potential for the economic remittance. Then we
exactly.
can't employ them. They're actually better off for
Yeah,
themselves and us if they
yeah,
explore these other opportunities. And it's exciting to hear that they're open to working with you and really talking through those issues from both sides. So let's talk a little bit. You mentioned Ghana and Kenya. What is the nature of the work that you're doing there? Can you talk a little bit, and we will probably talk more than a little bit about your Books for Africa initiative specifically? Yeah.
yeah. Sounds good. So a little bit of context. I spent 3 months volunteering in Tanzania in 2008 or 2009, really because I wanted to explore and grow and learn more about Africa. I'd spent some time in other parts of the world, and I lived with family and experienced. I was the only foreigner in kind of the area that I was, and experienced what that was like, and certainly hardships of living in a without the luxuries that we're used to. The home I lived in, we didn't have an oven or a kitchen or anything like that, and there's no windows on no glass in the windows,
Right.
but also all the great things and kind people and happiness and community. And so after my 3 months there, wanted to find ways to continue to give back, and so came across Books for Africa, really neat organization. And in essence, here in the United States, we have excess supply of books,
Yeah.
and where schools are constantly turning their books. So then the question is, what do you do with often very, very good quality
That
books?
might just be one edition outdated for
Exactly,
a
exactly.
medical program. Yeah.
Or a publisher might be have come up with a whole new edition. Edition 9 comes out of the
Yeah.
algebra book,
Yeah.
and so now the old editions that might be sitting in warehouses are not the newest edition that they want to push out through their distribution channels. So in the past, those books might have been destroyed even.
Yeah.
So Books for Africa collects large volumes of books, millions of books a year. Some years they've donated up to 4 million books in a year, and they try to match books with organizations or individuals like me that want to run projects.
Yeah.
So my first project was to Tanzania, to the community I lived with, and we worked with the Rotary Club, and we sent 30 or 40,000 books to that community and filled up some school libraries. And ever since then, every year or two, we're trying to send a container of books, 20 to 40,000 books. And then once I joined Worldwide a couple of years back, it just so aligned with the mission of what
Yeah.
Worldwide is doing. And Books for Africa has a great collection of medical books, medical textbooks, often Elsevier and some other really
Yeah.
highly regarded publishers. So we've sent I don't know the exact number, but I would guess we've sent over 100,000 medical books to Ghana, Ethiopia, Malawi, and we've got another shipment of 40,000 books that actually landed through port about 2 weeks ago, and I'm going to be heading over here in a couple of weeks to support that distribution.
That's a significant volume and impact for sure. So programmatically, how does that work? How do those books get to you? Where did they come from? How do
Sure.
you determine where they're distributed? And then are
Yep.
you tracking the impact downstream of how they're
Yeah.
being used?
So I will reach out or receive inbound inquiries from different organizations across Africa, and we kind of have a vetting process with them. And once we decide kind of the right partners to work with, they need to have some existing infrastructure, libraries, librarians. Starting a library from scratch is probably more than we could handle right now.
Yeah.
So if they have the good infrastructure and accountability, then they fulfill a book order form, and that's the needs that they have. It's not at the title level; it's more at the kind of grade level, subject level. So, for example, higher education, nursing textbooks would be a request, or primary school reading books would be a request. Then from there, I work with Books for Africa to go source those books and work on a shipping schedule. And then there's a lot of logistics to get the books from the United States on a boat, through port, through taxes, into a distribution center in Africa somewhere, and then ultimately out to schools or libraries. I'll try to get over there, and we'll have a big ceremony for the primary constituents. Usually the media shows up, and some students and some administrators. It's really a lot of fun. And then we push the books out to wherever they're going, and I'll try to go visit at least some of them. Regarding accountability, we've got a standard form that every recipient location fills out with a name, a signature. We ask them to take photos, to upload a video, and then I try to do some periodic follow-up over the years.
That's great. You mentioned to me earlier that you're heading to Kenya here in a few weeks. Is it for one of these ceremonies?
Exactly.
Can you talk about that?
Yep, exactly. So we're working with a institution in Kenya called KTMC, Kenya Medical Training or Teachers Training College, I believe it is. And the vast majority of nurses in Kenya to receive their diploma in nursing go through KMTC. So we've sent them 40,000 nursing and medical textbooks. They're going to they're being distributed through 2 locations, and they're satellite campuses all over the country. And depending on the needs, each satellite campus might get a couple thousand of those books to fulfill their library. So we're going to do a big ceremony. We're trying to get some political figures. Maybe there's some members of the cabinet in Kenya that might join the ceremony in Nairobi. So it's going to be great. A lot of fun.
That's a beautiful circle when you think about it. You're investing through this program and their training and education. You're working with governments to advance their for opportunity development, and then working with many of them probably at some point, helping them find opportunities for employment, which
potentially.
And then the remittances go back to the country. So there's a full circle going on there. That's great from end to end. Kudos on that. Yeah.
Yeah. Thank you.
Do you have other projects that you guys are doing, either there within the, those African countries or elsewhere that you're making investments?
So we try to do one project at a time, just due to capacity.
Sure.
So in aggregate, we've sent with this shipment, we'll hit 300,000 books sent. So
that's a lot.
I'm pretty proud of that accomplishment. Who knows? Maybe we get to a million books shipped one day. And you think about how many people might touch a book in a library or a school. Multiply that number by, 5 or 10 or whatever. We're talking about a lot of people that we've had some kind of impact towards, some little incremental impact that helped them on their journey.
I feel like there's the potential to replicate this model with technologies, with some bedside tech or telehealth or remote patient monitoring tools that, that support simulation and clinical hands-on training as well. I don't know if you're exploring that idea. That would be, I think, logistically harder to pull off. But, we hear a lot about, just throwing this out there, but we hear a lot about the disparity across nations with access to emerging tech that helps to certainly coming into the U.S. would help with job readiness in areas beyond clinical skills, like working with the HR systems or maybe working with, bedside technologies that maybe they haven't had exposure to where they come from. We hear that through our doors. The nurses who come through our doorways will say, I didn't have a lot of EKG experience in my country. We didn't do that, and they could use that upskilling. So just a thought. And I don't know if you guys are exploring more than just books in terms of that investment, but it seems like that would be a replicable model, though logistically more challenging, possibly.
Yeah, very supportive of the concept, and
Yeah.
the need's definitely there. We haven't launched anything like that. We've certainly had some discussions internally how to leverage technology and our U.S. based clients and their various training
Yeah.
resources to support international nurses and development. So I really like the idea. I think there's a lot to do there.
And probably this isn't necessarily your business model, but even the ability to keep some of those workers in country, but using remote technologies to be able to, earn a living for providing care virtually to other countries,
It is on our radar.
Yeah.
We're working on some neat things there as the world's shrinking and technology improving, internet access is improving. Mobile, there's some really neat work to do there that will be beneficial, I think, to both sides.
Absolutely.
And I think we're innovating when we're working on some neat stuff.
Yeah. So that's a great segue into my next question. What's on your radar for future projects? What are you most excited about that you guys are looking to next in terms of the evolution of your work in these countries or even the recruitment and training process there?
So, I think we want to keep the books projects going and working with different countries around the world that are supportive of the concept. Books for Africa, where we get our books from, is focused on Africa. I know there's other countries around the world that could definitely use the needs.
Sure.
Part of the relationship with the book publishers is that the books would be specifically going to a set listed names of countries in Africa, so we are constrained to those requirements.
Yeah.
But there's a lot of we've sent book shipments, medical book shipments to this will be 5 countries, so there's a lot to go.
Yeah.
So around the books, I think the focus is really just to keep doing what we're doing. There are some discussions around e-readers and the American Manual. Books for Africa has a good relationship there, and there are some digital manuals that have been donated as well, and so that there might be some more collaboration there. So right now that's what our focus is.
That's a big deal. I mean, the Merck Manual, that's your go-to. I've spent most of my early career in medical transcription, and that book was never far from my reach on my desk. So, but the ability to have it electronically, and the benefit of that being updatable in a virtual way, and that would have great appeal, I would think, to the same people you're delivering these books to in those countries. Yeah, that's great. All right, well, we're getting to the end of our time. I would love to share with our listeners how they can find out more about Books for Africa, how they can find out more about the work that you guys are doing. Where would we send them if they wanted to contribute or get involved or at least find out about those programs?
Sounds good. So if you, on the Books for Africa website, there's a projects page. And on that projects page, we have our own projects page that lists all the different work that we've done, some videos, some thank yous from different administrators, and there's a donation button there. So I'd say the ways to get involved would be to donate for our project. A neat thing with Books for Africa is 100% of the dollars go to shipping. So the books are supplied for free by Books for Africa. Books for Africa warehouses the books on their dime. And so literally every dollar is going to shipping and getting the books from the U.S. to where they're going in Africa. So,
which is probably a heavy lift.
It is expensive. It is expensive. But thinking about when you're donating money, how much of that is going to the cause, what you're trying to accomplish.
Sure.
I feel great really proud and happy to be collaborating with Books for Africa. So you can donate money there. If you have a project that you're interested in, you can send me an email. My email is on that page. I think those are the two primary ways to get involved.
That's awesome. And we can find you on LinkedIn. Are you out there in the social
LinkedIn
space?
as well. Yeah.
Wonderful. Any final words, thoughts that you want to share before we close?
I'd want to encourage, for all Americans that are listening, to go see the world and explore and immerse yourself in experiences and grow. And I think our country will benefit with our citizens growing and exploring culturally.
Becoming global citizens, truly,
exactly.
in reality and not just ideologically. Yeah, that is a great way to close. Louis, thank you so much for joining me. It was great to have you. I love the work that you guys are doing. We appreciate the partnership, certainly. And I hope people will come check it out and take your advice. Thanks so much for being here.
Sounds good. It was a pleasure being here. It was a fun discussion, and looking forward to working together more.
Absolutely. All right, everybody. Thank you so much for joining us for this episode of Care Anywhere. We'll see you next time. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at truemerit.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.